Hi, it's Dr. C here with another memory. And this memory is entitled One of the Best Clinical Experiences I Ever Had in My Entire Life. And the interesting thing about this memory is that the incident that I'm going to describe took place not in the United States, it took place in Japan. Now, you have to understand that psychotherapy doesn't necessarily cross cultures. If I know how to do psychotherapy in the United States, it doesn't mean that I'll be any very successful at all if I do it in Japan. And it isn't that I did psychotherapy, but still, even talking about clinical issues to people in another culture is very tricky. When Dr. Hara invited me to come to Japan, she asked me if I would do a talk to a group of parents of children who had ADHD. And I thought, well, that's easy peasy. I mean, ADHD is one of my topics. I've done videos on it. I'm an expert in that area. I've treated lots of children with it. No problem whatsoever. But just to be on the safe side, I grabbed this gigantic psychiatric textbook that talked about different techniques that you could use with different problems. And I loaded it in our luggage, and we lugged it with us to Japan. Now, Mary thought I was a bit crazy taking this gigantic textbook on top of taking Elwood and all the other things we took, but the textbook came with us. When I got to Japan, I was talking with Dr. Hara, and she says, I made a mistake. I says, you made a mistake? She says, yeah, I told you that the lecture was going to be to parents of children who had ADHD, but it's actually going to be to parents of children who have been diagnosed with autism. I thought, ooh, that is a mistake. That's a whole different lecture. So I got my giant textbook out, which luckily I had with me, and I began to prepare a talk to give at this lecture. The lecture was to take place at a school, and the parents would be sitting where the students normally sat, but I'd be lecturing them about their children and concerns about autism. So Mary and I went with Dr. Hara, and she took us to the school. And when we arrived, the teachers were lined up on either side of the sidewalk that led to the entrance. And as we walked in, they were all bowing to us. So we walked in, and we're getting bows from everywhere, And I never had an experience like that before. That's not normal in the United States. I knew I was in a different culture then, but it felt marvelous. They were all honoring us with these bows, and it just felt so great. First thing we did after we got into the facility is we went to the teacher's lounge, and they served us tea and pastries. And we sat on the floor, and we're having our tea and pastries and talking to the other people that are there. Now, two of the people that were there were two women who informed us that they were supposed to be our interpreters. They were both hostesses on airplanes. And then they told me, we talked about this and we decided that our English wasn't good enough. And because our English isn't good enough, we don't want to ruin your presentation, so we're not going to interpret. Well, now I'm in really trouble. Now, a lot of people in Japan understand English, but not a lot of people in this room understood English. They were pretty much just straight Japanese speakers. And so I began to get worried. What am I going to do? I'm going to give a talk. They're not going to understand what I'm talking about. Well, I thought I'll do something with my puppet. They'll like the show. It'll be entertaining. They'll get something out of it that way. So I go into the room, and sure enough, there's all these parents sitting in the seats. And in the back of the room, there's about 5 parents, each one of them with a child standing with them. They're standing in the back. And my initial guess is these children probably have autism. Their parents are keeping them in the back so that they will not disrupt my presentation, which is very thoughtful. And they know that if the child begins to act out, they can quickly exit. So I thought that was a good plan. And then I got up and I got Elwood out, and we started doing our stuff, and we're singing a song. We sing our intro song, and we're doing some things. And I look out at my audience, and none of them are paying any attention whatsoever. It's devastating. I'm thinking, this is not going well. So then I look back and I see the children again, and I think, autistic children tend to respond well to ventriloquism puppets. Dr. Hatter and I have talked about this, and it's one of the reasons that I'm there. And they will give eye contact to the puppets much more frequently than they will give eye contact to people. So I thought, I'll bring the kids up, and at least I'll have them in front of me and they'll watch, and maybe that will involve the group. So I go back and I gesture to the parents that I want their children to come up forward and sit in front of me, so that it's a puppet show, And they allow me to bring their children to the front. So now I have these 5 children sitting in front of me on the floor. And then I go and I get Elwood again. And I start my little show. And I'm doing my show and da-da-da-da, having a great time. And I look down at the children, and they're not paying any attention whatsoever. They're not looking at Elwood. They could care less about me. They're just kind of looking around. They're not paying any attention. And then I look out at the parents, and they're not paying any attention. And I think, wow, I'm in real trouble here. I don't know what I'm going to do. Then I look over, and there's a table to my right that has a container of treats for the kids, or for us, for me. And I think, I think I can do something with these treats. So I take Elwood, and I put Elwood down, and I get the bowl of treats. And I go to the first child, and I take a treat, and I say, look at me, look at me, look at me, look at me. And as I'm saying that, I'm moving the treat across until it's right in front of my eyes. And the child, of course, follows the treat. And as soon as the child is looking directly at me, I say, good. And I pat the child on the shoulder, and then I give him a treat to eat, and he pops it in his mouth. And then I move to the next child. Same thing. Look at me, good. Pat him on the shoulder, give him a treat. And I'm working the line now. Well, the children are looking at me now, all of them. They don't understand what I'm saying, but they know that they're going to get a treat, and they're following those treats and waiting for their chance. And one little boy knows how to sign. And this boy is going like this, like, more, 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 more. And I'm working this line. And then I look out at the parents. And all of a sudden, the parents are paying rapt attention, because I am working with their children. I am getting my hands dirty, so to speak. And that's what they're interested in. They're not interested in a puppet show. They're not interested in me. They're interested, of course, in their children. And so things are now going better. Additionally, when my interpreters see that things are going better, they decide to interpret for me. So now I have people interpreting, along with Dr. Hara, who's also helping out because she speaks some English as well. And everything is going much better. And after I've done this demonstration, I begin to talk to them about some of my goals. And one of my goals was to explain to them that it's not the parents' fault that the children are autistic. And it specifically is not the mother's fault, because in Japan, mothers were blamed for this. It was their fault that their child was this way. So they felt miserable. It wasn't only in Japan that they got blamed. They probably got blamed around the world. They got blamed in the United States back then too. Parents of autistic children were called refrigerator parents, who only defrosted long enough to conceive a child. So this was a prominent belief around the world. And I told the mothers, and there were a few fathers there, I said, it's not your fault. This is inherited. It's genetic. It's not your fault. And a lot of them began to cry, because they were carrying around so much guilt inside of them, taking the blame for their children's disorder. And it was amazing, because this was very therapeutic for them to hear someone from America who's supposedly an expert in this area telling them that it wasn't their fault. And that was one of the highlights of this presentation. The other thing I did is I set up support groups so that the parents could meet together and figure out how to help each other deal with the concerns. And those were the two goals that I had in mind when I came there. Tell them that it wasn't their fault and set up the support groups. And much to my surprise, this turned out to be one of the peak therapy experiences I had in my entire career, and it was in Japan. And on that note, I say bye for now. Back again with the one more thing segment. You might have asked yourself, how did Dr. C know how to use that candy to get the children to focus on him? Well, truth be told, it was just luck. Years earlier, I worked at a hospital that had children who were developmentally disabled, profoundly and severely impaired. And this was a technique we used to get them to focus on us. And it's basic Skinnerian reward system. Skinner was the one who used rewards, food and things like that, to train people or train animals or whatever to do what he wanted them to do. So we would do the same thing with some of our patients to get them to give us eye contact or to do other things. And it was just blind luck that I happened to have this skill and that I was able to apply it years and years and years later in Japan. So I was lucky. If I hadn't been lucky, that experience probably would not worked out anywhere nearly as well. And that's the end of this short one more thing. Bye-bye. Hi, it's Dr. C again. And in this segment, I wanted to clarify a little bit about what I told you in the last segment. I mentioned in the last segment that it was blind luck that led to me being able to do what I did in Japan when I used an operant conditioning technique to teach the children to look at me. Well, that's not exactly correct. It was not blind luck. It was education and training. I have had a lot of education and training on how to use operant conditioning with children. And my first knowledge of this whole conditioning idea was in my freshman year in 1965, so it's a long time ago. And I was a freshman at Arizona State University, and we were learning about Pavlov, who was the father of conditioning, of classical conditioning. And what Pavlov did is he would ring a bell, and then he would put food in front of the dog, and the dog would salivate. And eventually, the dog learned to salivate when the dog heard the bell ring to begin with. And that was the beginning of this whole field. And Pavlov, when I took the test on Pavlov, I like to use associations. I didn't like to study very much, but I like to come up with clever ways to learn what I needed on the test. So I wrote the following song about Pavlov so I would remember this technique and who started it. When I was young, so much younger than today, I could only salivate the common way. But now I'm older and I've grown more mature. I have learned to salivate the Pavlov way. Salivate you all along with me. Yes, we'll salivate all day, what fun 'twill be. Salivate, yes, Pavlov found the key. Won't you please salivate with me? Anyway, that was my first experience with conditioning. And I got an A on the test. In fact, I got an A in that class. I really loved that class. It was the best class I had the entire time I was at Arizona State University. But I was only there for one semester, and that's another story. But it was my favorite class at Arizona State. Later on, when I started going to UNM and I took the second semester of freshman psychology, beginning psychology, I learned about operant conditioning, which was developed by B.F. Skinner. And in operant conditioning, we give the person or the animal a reward after they do what we want them to do. And I'm not going to go into a lot of details in it. I will tell you that there's a story, which may be apocryphal or maybe not, that Skinner raised his daughter in what they called a Skinner box, where she could get rewards by doing things. I don't think it's true, but it's an interesting concept because he was the father of operant conditioning. Now, I had this professor in college later on when I was a junior or so, who was very, very, very bright, but not necessarily the nicest guy around. And he told the story about being in a class in which the students didn't like the professor. And the students noticed that the professor used to occasionally clear his throat. So they got together and they decided that they would use conditioning, operant conditioning, to encourage him to clear his throat more and more frequently. And what they did is they just quit paying attention. They looked bored. They didn't raise their hands when he asked questions. But as soon as he cleared his throat, they all sat up, got smiles on their face, raised their hands, participated. Well, lo and behold, the frequency of throat clearing increased to such a number that he had to take time off because he couldn't teach his class. All he was doing was clearing his throat. Now, do I believe that this story was true? It could have been. I don't really know. I didn't necessarily trust this professor to always be honest about these things, but it was a great story just the same. Now, he told another story about how he used conditioning. This one I do believe. He had a neighbor next door, and he really didn't like the neighbor, and he particularly didn't like the neighbor's dog. Well, the neighbor was going out of town, and he came over and he asked the professor, he said, "Would you watch my dog for me while I'm gone?" And the professor wanted to say no, but he says, "Oh, of course I'll watch your dog." So he took the guy's dog, and while the guy was away, the professor trained the dog to bark. Every time the dog barked, he gave him some food. Every time the dog barked, he gave him some food, popped it in his mouth or whatever. When the man returned, he gave the dog back the professor gave the man his dog back. And a few days later, the man came over and he says, "What did you do to my dog? There's something horribly wrong with him. All he does is bark constantly." And the professor said, "Well, he was fine when he was at my house." So that's playing a dirty trick with operant conditioning. And like I said, I would not put that past this professor. After I graduated from school, I got a job. Well, actually, before I graduated from school, between my senior and junior years, I got a job working at a hospital in Porterville, California. And this was for developmentally disabled people. And they were doing a lot of research on using operant conditioning to help their patients do better. And my assignment, the assignment that they gave me, was to teach a young woman to dress herself by rewarding her every time she did what I wanted. And it went well. It was a successful experience. Anyway, later on, after I graduated from college, I got a job working at a hospital, a similar hospital in New Mexico. And this hospital was not nearly as far advanced in terms of what they were doing. And they weren't using conditioning. Basically, all they did was take care of the patients and watch them. And they weren't really teaching them much of anything. And they hired me because they wanted the psychologists to begin to focus more on teaching the patients rather than on just coming and testing them. So, one of the things that I set up was I set up a program to teach a young man to feed himself with a spoon. And initially, it didn't work out too well because I thought every time he begins to feed himself with his hands, I'll take his food away. And then the next day, we'll start again. Well, that wasn't going to work. He was going to starve to death. So I quit that very quickly, almost immediately. And what I would do is every time that he started to use his hands, I would take away the plate, and then I would count. I don't know, give him a minute or two of, being, away from it. Then I'd put the food back. So I increased the number of trials I could use. And eventually I taught him how to feed himself with a spoon. What's interesting is that later on, I had to do a video to show some of the work that I had done because they wanted to evaluate what I was doing. And I wanted to do before and after pictures of this young man, first eating without a spoon and then eating with his spoon. The problem was he wanted to eat with his spoon. So I'd let him start eating without his spoon, and he'd be eating with his hands. And then I would sneak the spoon in, and he would pick it up and start eating with his spoon. And he was blind, among other things. But I guess he would hear the spoon come, and he'd just pick it up. So here I am trying to fool this really profoundly or severely mentally disabled man into eating without a spoon. And eventually I solved that problem by putting the spoon on the wrong side of the plate, and then he didn't know what it was and he ate without his spoon, and I got my before and after pictures. My boss at this place didn't like me. And when I started teaching the patient how to feed himself with a spoon, my boss came up to me and he says, well, that's very good. He's now feeding himself with a spoon. But now the floors are much dirtier. He says, so from now on, you're going to have to mop the floors because it's your program and you're going to have to take care of this. So I responded by teaching the patients how to mop the floors. That didn't go over really well. So this was not my favorite boss of all time. In fact, was probably one of my least favorites. But that too passed. Now, that kind of concludes this piece, and you need to be aware again, it wasn't blind luck, it was education and training. And after this ends, I want you all to immediately sit down and feed yourself a special treat to increase the possibility that you'll watch more of my videos. And on that note, I say, bye for now.
My name's Elwood.
Dr. C.
I need Funwood.
Real flesh, that's me. Psychologist.
And Doctor Who are here because we care for you. Ta-da!
Very good, Elwood.
Thank you, Dr. C.
So, what'd you think of the stories today that we told, the memories?
Well, I didn't really like that thirst memory.
You didn't like the first memory?
No.
Well, why didn't you like the first memory?
Well, you took me all the way to Japan, and then you just tossed me over on a chair and worked by yourself. That's not very nice. No.
Well, we weren't working well enough together to help the people, so we had to do something else.
I don't understand.
Well, the goal of being there was to do some good for these people and help them deal with the problems they were having with their autistic children. And we weren't helping because they didn't understand anything we were saying, and nobody was paying attention to us.
Oh, so you just kicked me aside.
Well, I didn't kick you aside.
You just tossed me aside.
Well, yeah, I kind of just tossed you aside. But you got to perform other times while we were in Japan.
Well, that's good to know.
In fact, you got to perform a lot. You got to perform on stage. You got to help me teach people other things.
Well, I'm glad it wasn't a total waste. But I thought that was unfortunate that I missed out on that. That was one of your best experiences ever. And I wasn't in it.
Well, you were in it. You were in it. You just didn't last very long.
Okay, I understand. And anyway, and then some of those other stories were weird too. Who wants to teach a dog to spit all the time?
Who wants to teach a dog to spit all the time? Pavlov.
Huh. Well, I never drool.
You never drool?
No. I have a very dry mouth.
That's true. You do have a dry mouth and you never drool.
You got that right, Dr. C.
Anyway, you know what I've been doing recently? What have you been doing recently?
I've been telling you everything you want to hear.
Why are you doing that?
Well, I figure that if I just tell you what you want to hear, I'll teach you to take me out of that suitcase more and more often.
So you're trying to condition me.
You got that right, too.
There's a problem with that.
What's that?
Well, everything you're telling me, I'm actually saying.
This is very confusing. But you are taking me out more, so I think I'm making progress.
I guess you are making progress.
So I'm just going to keep telling you what you want to hear. You're very handsome, Dr. C.
Well, thank you, Elwood.
I like you a lot. You're so funny.
Thank you, Elwood.
I like coming out and playing like this. I like entertaining.
Thank you again. And that might work. You just keep telling me what I want to hear, and then I'll probably take you out more.
Well, I think it's worth a try.
Anyway, you have a last thing you want to say?
Yes, I do. Yes, I do. Yes, I do. Turnabout is fair play.
A poem by Elwood Splinter.
Pavlov, Skinner, and Dr. C are part of a clever conspiracy to get dogs and kids and grown-ups too to only do what they tell us to do. Well, I'm starting my own plan today, yes today, to train Dr. C in my own special way, so that he'll take me out of my suitcase all of the time, and that is the end of my short little rhyme. See you guys later. Adios. Sayonara. Tschüss. Ciao.